is to meet all the public health, county public health officers from the 47 counties. This is the first of the first that has happened since devolution, and I am happy to start a conversation with them to rekindle public health issues driven by the public health officers across the country. And you remember when we were growing, maybe those who grew during my time, we could see public health officers coming to inspect schools, to inspect even our homes, to inspect facilities, you know, food kiosks, and nobody could operate without a license. But I think it's time that we enforced these issues so that we can give the people of this country better. It would be important to ensure that if we reduce issues of foodborne diseases, waterborne diseases, you know, vector-borne diseases, diseases like malaria, and at a prevalence of 6% in the country today, we are struggling to lower the prevalence of vector-borne diseases like malaria in the country. And so is cholera. Cholera is a disease that is preventable. With the rollout of our community health promoters, the 107,000 community health promoters, we are seeking for collaboration between the health workers and the community health promoters to ensure that there is interrelatability and there is also coordination and to give our people at the bottom of the pyramid the information they require. If it is the work of the community health promoters, taking blood pressure, blood sugar, reminding caregivers and mothers to take their children for vaccination, telling them what to eat and how to even grow their kitchen garden for a better country. Prevention, promotion, and protection is the way to go. Secondly, I've also taken time to pass through Machakos Level 5 Hospital. You can see I'm with the officers here. And one of the key things that I wanted to find out is if services indeed are being rendered. And I have found mothers who have just delivered to just note that they have gotten services properly. And we are hoping that with the SHA rollout, services are going to be super in most of the hospitals, and we implore to the people of this country to register for the Social Health Authority because in one way or another, there are three things that we have to learn from the Social Health Authority. Unlike NHIF, where only 20% of Kenyans used to get services through NHIF, we are rolling out to 100% of Kenyans, including you and me, that nobody will ever go to hospital in this country again and fail to get services or fail to get attended to. And there are three funds that will take care of that. There is the Primary Healthcare Fund, which is going to take care of our mashinani, dispensary, and health facilities. Then we have the Social Health Insurance Fund, which is going to take care of the secondary and the tertiary services. And there is the chronic, the emergency, chronic, and critical illness fund, which will take care of the long-term ailments as we move forward. Therefore, it is very important, our collaboration with the county governments. Our SHA teams have rolled out to the ground, our CHPs and NGAOs, the National Government Administration teams, and I've been with the DCC the whole day. They are doing a very commendable job to register individuals and households across. In Machakos specifically, the national government, in collaboration with the CHPs, they have been able to register 147,050 households in this county alone, and it will continue. And they have been able to sensitize more than 193 households in this county. We will continue being here. We are here even tomorrow because we have to activate our Epuka Uchafu campaign, national campaign, that is going to take place here tomorrow for the activation of the Machakos chapter. Epuka Uchafu basically is a public health campaign that will be taking place on a monthly basis. And we are talking about personal hygiene, we are talking about environmental hygiene, water and sanitation. When you look at those three areas, those are the areas where if you do not take care of that, you get minor ailments like um, waterborne diseases, you know. If you don't take care of the environment, most of the illnesses and ailments these days comes from climate change issues, you know, and then environment at large. So we want to really push this to school-going children, that it is important for people to clean their hands. When you wake up, clean your hands. When you go to the lavatory, clean your hands. When you want to eat, clean your hands. When you want to sleep, clean your hands. When you want to do anything, clean your hands. That is the call, the rallying call. We don't want to drop the ball from what we saw during COVID-19. And remember, right now, we have mpox. We already have 13 confirmed cases. And if we do not pick some of these practices to ensure that we curb the spread of diseases, then the ball is back on our court. So clean your hands, drink clean, boiled, safe water. Ensure that you have a latrine in your compound. Ensure you have a toilet in your compound or in your house. Ensure that you eat warm food. Do not eat food that was cooked yesterday and is still in the cupboard. You do not know what virus or what germs have gotten into that food while you slept. So it is important to take care and prevent our foodborne diseases. Tafadhali nimewaambia mambo mingi hata msiulize swali.
One question, Katibu.